Hello, everyone. Welcome to July edition of My Health Matters. Hello, everyone. It's good to have you here. Please drop your favorite emojis as you come online. Yes, it is July 2024 edition of My Health Matters, and we're looking at peptic ulcers, a common condition in digestive system. Let's drop our favorite emojis. So we're going to start by 8:05. Let's drop our favorite emojis. Let's invite our loved ones to join so they can be a partaker of this teaching. Thank you. Yes, welcome once again to July edition 2024 of My Health Matters. Yes, our health matters. And our topic for today is peptic ulcer. So, like I said in the announcement before today, that we have looked at the different organs, the normal parts, the um how these our organs, the GIT, how they work normally. So this is really going to help us in understanding this peptic ulcer today. So let's kickstart. Thank you very much for joining once again. Please let's drop our favorite emojis as we come online. So in the course of the teaching, you might not see my face sometimes, but you will sure see my slide, okay? And you will hear my voice. Thank you very much. So let's start. So today's topic, like I said, is My Health Matters, peptic ulcer, and we can see from the slide. So the content of today's teaching, we have overview of peptic ulcer, the definition, the causes, signs and symptoms, management, complications, prevention, dietary and lifestyle changes that can be of help in managing peptic ulcer. I want to have this belief that one point or the other, one we might have had like symptoms of peptic ulcer. So let's get on to the class and we can confirm that. So the overview of peptic ulcer. Stomach ulcers, also known as gastric ulcers, are sores that develop on the lining of the stomach. You can also get ulcers in parts of the intestines just beyond your stomach, and that is what we call duodenal ulcer. That's the intestine, the small intestine. So stomach ulcers and duodenal ulcers, which generally is what we call peptic ulcer, causes the same symptoms, and treatment for both is the same as well. The most common symptom of a stomach ulcer is a burning or gurning pain in the center of the tummy. That's the center of your abdomen. That's the most common symptoms. We hear, oh, I can't really explain. I just feel my tummy is paining me. It's really peppery. It's hot. It's burning. These are some of the things that we come up with, and you might be like, oh, maybe because I've not eaten. Is it because of what I ate? Quite a number of things, and we start thinking about a lot of things. So let's see. But stomach ulcers aren't always painful, and some people may experience other symptoms. This is to let us know that stomach ulcer might be there, and if it is well managed, you might not experience some pain. And other symptoms aside pain is indigestion. You can have heartburn. There can be acid reflux, and you might feel sick. You might feel nauseous. You might feel like you want to vomit. So if you think you may have stomach ulcer, you're passing that sticky tar-like stool, or you have a sudden sharp pain in your abdomen, in your tummy, that gets worse steadily, or you are vomiting blood. It might be red, it might be dark brown, it might be what we call coffee brown, coffee ground. All these things, when it happens, are signs of serious complication. And sometimes there can be internal bleeding. And note, this is an emergency and you need to seek medical help immediately. So this is an overview of peptic ulcer. Move on again. So what is the definition of peptic ulcer? How does it occur? I want us to remember scenarios, situations whereby, so I want us to remember situations whereby we had a cut, you've had a cut before on your hand, or maybe on your face, or any part of your body, like outside. So just imagine that same thing is happening inside your stomach. So in a layman's language, it's as good as peptic ulcer is a wound in the stomach. It's as simple as that. But a lot of things that can cause it. So peptic ulcers are open sores. Note, open sores that can be found in two places in the stomach, or let me say in the GIT. Yes, in the GIT, and that, but majorly in the stomach. And the second one is the first part of the small intestine. That's the duodenum. So it's either is in the stomach or is in the small part of the small intestine, which is known as the duodenum, and that's closer to the stomach. So that explains why it can affect that part. So these painful sores develop when the acidic digestive fluid in the stomach eats away the protective lining of the organs. And what's the organ in question? The stomach or the duodenum, thereby forming an open wound, forming an ulcer. Ulcer means open wound. So now, what is this acidic digestive fluid? If we remember in biology, there's what the stomach produces hydrochloric acid. And what is the function of the hydrochloric acid? Is to work on the food that gets into the stomach. So we are getting somewhere. Let's continue. So left untreated, peptic ulcers can lead to serious complications. Very serious complications. It can lead to bleeding in the stomach. It can lead to perforation. It can lead to cancer. A number of things. So what are the causes? Stomach ulcers happen when there is a damage to the layer that protects the stomach lining from the acid in your stomach. Remember I said hydrochloric acid is being secreted into the stomach. And we talked about glandular organs as well in the articles in our Wednesdays. So when there is a damage to the layer, to the lining that protects your stomach, when there is a damage to it by that digestive fluid, hydrochloric acid. And what is the function of hydrochloric acid? Its main function is to act on food. So invariably, when it doesn't have, there's no food there, and it needs to do something. Remember, acid are corrosive. They must act on something. So it acts on your lining, and then before you know it, there's an open wound. And this is usually as a result of an infection known as Helicobacter pylori, H. pylori bacteria. It's a bacteria, and it can be found it can get into our body system in a number of in different ways. But one of the common one is poor personal hygiene, because it can be gotten through stool, through saliva, through vomiting. So someone that has H. pylori bacteria in his or body system, because it can be transferred through saliva, through vomiting, through kissing, through a number of things. It is droplets. Yes, it is a droplet kind of transferable bacteria. So now, reason why I said poor personal hygiene, possibly someone with H. pylori just pulled on the floor and you pack, or in a way the person didn't wash his or her hand or did not clean up well and such other things, and you too, you don't know, you touch those things and then you eat, it's gone inside. Can be gotten from, like I said, vomiting. So whatever thing that it has dropped on and it is not cleaned up, and someone else touches that thing, and the person too does not wash his or her hand, and they use it to eat. So we can see the importance of hand hygiene. Hand hygiene is not just for health workers alone. Every one of us, it is for us, not for anything but for our own safety. So another thing that can cause it is taking anti-inflammatory medicine, which we know as NSAIDs, non-steroidal anti-inflammatory medications, such as ibuprofen, aspirin, then diclofenac, particularly if they are taken for a long time or at high doses. Oh, ye personal prescribers, small headache, diclofenac. Oh, my body is paining me, ibuprofen without prescription. All these medications can cause peptic ulcer. Because the way they are being done, you need to eat first before you take them, because their component tends to eat up the lining of the stomach. Or you take a stomach liner, we'll get there in the course of the class, before you take them. But headache, ibuprofen works, paracetamol works, and then we take it and like it's gone. The headache will go, but the effect of that drug over time, remember, for a long time or at high doses. So maybe ibuprofen now, normal dosage, let's say 400 milligram, and you're like, this headache is too much. You took 800, you took 4 tablets, and you keep doing that consistently, because life on its own is stressful, and possibility of having headache, you are stressed out, is on the high side. So imagine you've been taking diclofenac, aspirin, ibuprofen for a long period of time, because you want to treat headache, you want to treat body pain, you want to treat back pain, you want to treat leg pain. It can cause peptic ulcer. Another one is starvation. Remember what I said, that hydrochloric acid is like it's being produced, is a normal is a normal physiology of the body system. So it's being produced. So you decided to starve yourself, you're not eating, you're not fasting, because if you are fasting, we have timing. But you decide to not eat for days, or you're on a very long fasting. What happens when you do that is the hydrochloric acid will keep on eating your stomach line, and before you know it, open wound. Now the other one is poor personal hygiene. Like I explained earlier, you don't wash your hand, anything goes. You buy fruit from the market, it's none of your business, you don't wash it, you just take it and you start eating. You buy snack, you buy pepper, tomato, quite a number of things, but you're like, the heat will kill it. When my stomach, when I eat it, all the things in the stomach will kill the germs. But what if H. pylori is on those items that you've gotten, and you did not wash them? So that's how poor personal hygiene can cause ulcer. So as we can see in this diagram, if let me make it bigger. Yes, as we can see in this diagram, gastric juices, we can see them. They are the ones there. So excessive amount of gastric juices are released into the stomach, and now there's nothing there's nothing for them to act on. There is no food. So invariably, they eat up your stomach lining. So excess secretions eventually break down the lining of the stomach, forming an ulcer. So that is just it. That is what it's about. So you can see the duodenal ulcer. That's just a little bit down the stomach, and that is the beginning of the small intestine. Yeah, and the one in the stomach is that one. Okay, so what are the signs and symptoms of peptic ulcer? So let me establish this. When I keep saying peptic ulcer, it can be stomach ulcer, it can be the stomach, it can be the duodenal ulcer. Their symptoms they are the same. Even the treatment are the same. So what are the signs and symptoms? Depending on the severity of the peptic ulcer, you may experience some of these symptoms: dull or burning pain in the stomach. It can be so sharp, it can be dull, and your stomach is on the left side of your body. Yes, let's try and touch that. Left side of your body. So that is why when you tell your physician or someone in the healthline that, oh, I have a stomach pain, they ask you which side. Is it right side or left side? So your stomach is on your left side. So you can have a dull or burning pain in the stomach. It can be so excruciating that you might even need to bend down. It can be as excruciating as that. And the most common symptom is that one, is a dull or burning pain in the stomach. And usually it is felt in the upper abdomen, just as if it's coming up to your chest. Heartburn sometimes as well. Excuse me. And It can be around your navel, it can be around your breastbone, it can be around the stomach itself. Remember I said your stomach is on your left side. And if we look at this diagram again, can you see this? The duodenal part, this part. So if you look at it apparently, this is more like the center of our, remember this is left side. But if you look at this one, this where I'm putting this cursor, is as good as the center of the body. Yes, see. So that is why you can feel ulcer pain around your navel. And that is why it can extend to your breastbone area as well. So another thing is it can last for minutes, it can last for hours. It can. It happens on and off for several days. So you might experience it maybe in January and you might not see it again to maybe September or November or December. So it lasts, it can really be for several days, it can be for weeks, it can be for months. And we have people that it has really made them not to focus on work because they are always in and out of the hospital. So those are those that fall under the category of days, and that means it's so severe. So it also happens when your stomach is empty, like in between meals. You've eaten breakfast, but the time between your breakfast and your brunch or your lunch is a little bit extended. You can feel that kind of pain as well. And another thing to note is that the pain from duodenal ulcers tends to happen at night. Or also the pain can also be when you're eating a meal, or after you've if when you're eating a meal, or you've delayed to eat a meal. Yeah, it can also happen. The pain can come up as well. And one of the things that really helps it is antacid, which we are going to look into as we go on. So other symptoms such as heartburn, belching, black stools, bleeding, unexplained weight loss, vomiting of blood, you are feeling nauseous. All these are danger signs and they call for attention. It is a medical emergency. In a situation whereby you start vomiting blood, you start seeing blood in your stool, you are losing weight unnecessarily, you can't explain the reason for the loss of weight, then it's a medical emergency and you need to see your doctor. So moving on, what is the management of peptic ulcer? Before it can be well managed, the cause needs to be known. And that is where diagnosis come into place. And apparently, that is why when you go to the hospital and you explain your symptoms to your doctor, most times they want you to carry out investigations, not because they want you to waste money, or yes, not because they want you to waste money. It's just to know what exactly is causing that your symptoms, your signs and symptoms, because signs and symptoms are just what we see outside. A lot of things are going on underground. So when you are being asked to do some laboratory investigations, is to be able to know what exactly we are treating and not treating it blindly. So if your doctor suspect that you have peptic ulcer, they might review your medical history, do some physical examination. Oh, is it painful here? Is it painful around there? And based on your results, your doctor can recommend some other tests. And one of the major tests that is being done now is to test for H. pylori infection. Remember I said it's a bacteria. So they can take blood sample. It can be a breath test. It can be a stool test. And when all this is done, if there is H. pylori, it's going to show it. And when there is H. pylori, the doctor knows, oh, this is what is causing this, and he can treat it for you. Another diagnostic method that can be done is endoscopy. It involves insertion of a scope into your esophagus to examine your digestive tract. So it helps the physician to see into your stomach very well, down into your small intestine, so they can really see what those wounds that are in your stomach lining. It really helps. And sometimes they can take a sample just to see what is there, because there are sometimes that um some ulcers like that can be cancerous, and sometimes they might not be cancerous. So that is what it means for further examination in a lab, depending on the signs and symptoms that you present with. Yes, I need to establish that. Depending on the signs and symptoms that you present with, will depend on the kind of investigations that will be done. So other ones that can be done is upper gastrointestinal series, where you can be asked to drink a liquid suspension. It can contain barium. It will coat the inner lining of your stomach, then x-rays, and a lot of things can actually be done. What I'm trying to establish with this is, don't always be in an hurry to, oh, I have these signs and symptoms, just give me medication, I'm going home. No. Let's take investigation serious. In fact, it prevents you from taking a lot of medication, because all these things affect our liver, they affect our kidney. So when the doctor knows it is H. pylori, then he knows he's treating H. pylori. If he knows that, oh, it is caused by poor personal hygiene, he will know the recommendations to give you. So let's move on. What are the treatment options of peptic ulcer? So depending on the severity and cause of the signs of your condition, of what you present with, your doctor can recommend the following medications to reduce the stomach acid, like how often, and help to heal the ulcer. So if the peptic ulcer is caused by NSAID, remember I talked about aspirin, ibuprofen, diclofenac. So if that is what is causing it for you, the doctor may advise you to stop it, or you reduce the consumption of the NZ. Maybe you are taking it twice in a day before, he can decide to advise, oh, reduce it to once in a day, or stop it totally, depending on how the severity of what the NSAID have caused in your stomach or in your duodenum, and he can prescribe other ones for you. So another option is protein pump inhibitors to reduce the stomach acid and prevent and protect the stomach and the duodenum lining. And examples of this are omeprazole, lansoprazole, and the likes. So what they do is to protect the stomach lining, at least before you eat. So, and it's really doing the job well. I've seen quite a number of patients that are being placed on it, and the signs and symptoms have really reduced. But like I said, don't self-medicate. And all what I'm doing, the teaching is not like, oh, Nurse Damia said this, I'll go and do it. No, it is not. You need to see your doctor, because you don't know what is causing it. So another one is antacids to quickly weaken or neutralize the stomach acid for symptom relief. Remember, the hydrochloric acid is an acid, hydrochloric acid. So antacid are more like they're alkaline. And remember, biology, physics, chemistry. So acid, alkaline, by the time they come together, it becomes neutral. So that is why when you take antacid, you take Gestid, you take a number of mostly Gestid or excuse me, you take a number of them, and after some time you feel relieved. The reason is acid is in your stomach, so it's causing burning sensation. Now you've taken an alkaline, which is an antacid, it's going to neutralize, so you feel relieved, at least for some time. And that is why someone can take the antacid like 4, 5, 6 times in a day, depending on how the symptoms surface. So another one is prescribed antibiotics to kill the H. pylori bacteria. Remember I said it is a bacteria. So if that is the cause and your own is not NZ, then what is needed is to treat the bacteria that is causing it. And once the bacteria has been totally treated, then you feel relieved. You are fine. So your doctor may also recommend the following to prevent the progression of peptic ulcer. And that is one, avoid the use of non-steroidal anti-inflammatory drugs, like I've been saying. See, I kept on hammering them because I know we can use it a lot. Diclofenac, ibuprofen, aspirin. So your doctor can tell you to avoid the use of medications like that and prescribe something different, like something to replace it, because you might be in pain and you need painkillers, you need analgesic. So the doctor is going to prescribe something else for you. Then advise to stop smoking and alcohol consumption. He can only advise you. It is your choice. This life is a matter of choice. So, and smoking and alcohol, to be sincere, has been linked to a lot of conditions that are happening in our generation recently. Like, there are some conditions that are like, what can be the cause? And before you know, it is linked to smoking and alcohol, because all these things does more harm than good. So it can also advise you to practice good personal hygiene. You can imagine if what is causing the peptic ulcer is H. pylori bacteria, it has been treated, but you don't practice good personal hygiene, H. pylori will come back. You will have peptic ulcer again, and you will keep going around the same cycle. So why not stop the cycle? Practice good personal hygiene. Wash your hand. You just finish using the toilet, wash your hand. You just finished touching something that you know this thing is not good, wash your hand. Like I said, hand washing is not just for health workers alone. You got some things from the market, wash it. You got apple, you got fruit, vegetables, wash it before you eat them. All these things are for your good, because when you are sick, it is not the health workers that is sick, you are the one that is sick, you are the one that is in pain. So why not do yourself good? Another thing is to ensure you drink water that is clean, because you can still get it from water as well. When the water you are drinking is not clean and it has H. pylori, then automatically you have it. So the complications of peptic ulcer: inflammation of the stomach lining. Yes, H. pylori infection can affect the stomach. It can cause irritation and swelling. Gastritis is inflammation of the stomach. Remember, peptic ulcer is open wound. It is not inflammation. So if H. pylori is being left untreated, it can cause inflammation of your stomach, and that can lead to gastritis. Hemorrhage over time, just like we have an open wound. Just imagine you have a wound on your hand and you are not treating it. You neglect that wound. Automatically, after some time, it becomes worsen. And this one is a wound that is not outside, is inside. And Yoruba has an adage that wound that is inside doesn't heal easily compared to one that is outside. So if it's not treated on time and it keeps eating and eating deep, our stomach has layers, and it keeps eating deep, there will be bleeding in your GIT. And that is why I said the moment you start vomiting blood, or your poo, your stool has blood, it is an emergency. You need to go to the hospital. It is an emergency. And please don't wait till when it gets to that stage. So another complication, if peptic ulcer is left untreated, is stomach cancer. And I can tell you, I've looked after a patient with stomach cancer before. It was bad. It was very bad. At a point in time, his poo was purely blood. In fact, the point in time, his intestines were coming out. And you know, when you're packing poo and you know, no, this is an intestine. So cancer is not what should even come into the picture. So please, let's take our health serious. So H. pylori infection is a strong risk factor for certain types of stomach cancer. So please, personal hygiene. If it is identified, if your doctor has identified it that this is what is causing, please let it be treated. So what are the prevention, dietary and lifestyle changes that can be of help in treating for peptic ulcer? Number one is eat healthy. Avoid junks as much as you can. You know, there are a number of people that junks breakfast, junks lunch, junks dinner. This is unhealthy. Burger, fries, a number, like, no healthy plan. And there's nothing we can't be if we are being intentional. And in fact, I've come to realize that eating healthy is cheaper than when we eat junks. So eat healthy, avoid junks as much as you can. Remember, we are what we eat. Replace those junks with fruit. Replace it with parfait. Replace it with smoothie. Sometimes the reason why we are so addicted to junks is because we love sweet things. There are fruits that are sweet, yet they are healthy. Apple is a sweet fruit. Water is good. At least fruits that are in season are cheaper. I understand that economy currently has gone haywire, but we can still do something within our capacity. The fruits that are in season are cheaper than the fruits that are not in season, and there's a way God has really blessed the whole world that there are fruits that are in season. So when the fruit is in season, and fruits are perishable, so even the seller will not want to audit, want to sell it so fast. So if it is tangerine, if it is watermelon, if it is apple that is in season, try and eat it. If it is banana, if watermelon is getting expensive and banana is now cheaper, switch to it. But what I'm trying to say is replace junks with fruits. Replace it with parfait. If you are not a fruit person, myself, if you give me fruit to eat, you are just punishing me. But I can do it as parfait. I can do it as smoothie. And for smoothie, you can blend 3-4 fruits together. And the best way I enjoy my own is with straw. I can't drink it directly as well. That's why I said when we are intentional, there are a lot of things we can achieve. We can achieve anything when we are intentional. Nothing like where I am, it is not visible. It is visible. Eat the fruit that is in season. Like I said, if you are not the fruit type, blend it. At least buy what you know you can afford and eat healthy. At least a meat pie now or burger and the likes, will you not spend around 1,000, 1,500, 800, 500, and you can still get fruit for that same amount, and you are blessing your body. We are what we eat. Number 2 is try to drink a glass of water first thing in the morning when you wake up. Try it. Just try it. Tomorrow morning, try it. When you wake up in the morning, possibly after you finish praying, you finished meditating on your bed, you stood up, you stand up, just grab a glass of water and drink it. Remember, the last time you ate was in the night. You slept overnight. And I said something that when there is an interval between your last meal before the next one, you can have some pain as well. So drinking water is more like you're just trying to lubricate that part of you are trying to lubricate your stomach in a way. And it's healthy for your stomach, it's healthy for your kidney. So avoid taking medications without prescriptions, especially NSAIDs. Another medication that I know people abuse is steroids, hydrocortisone. People believe people that are light in complexion are the beautiful people. Me, anybody is beautiful as long as you take care of yourself. So in the bid of you want to become light, tube now, people have tube they add to their cream to rub their body, and these are medications, steroids. They can cause peptic ulcer as well, because any patient that is on steroid needs to be on stomach protect, like stomach liner, proton pump inhibitor. So if you've been using tube, adding it to your cream to rub your body, you are doing yourself more harm than good. Your skin will suffer it, your kidney will suffer it, your stomach will suffer it. In fact, a lot of your body's organs will suffer it. So stop using medications that are not prescribed for you by your doctor. Some of them corrode the lining of your stomach. There are safer options for you. Another one is avoid alcohol and smoking as much as you can. Avoid trigger foods that worsen your symptoms. If you notice you eat corn and you start feeling pain, leave corn alone. Allow corn to rest. If you know you eat beans and you start having heartburn and the likes, Leave beans for the meantime. You can try to make research on what you can do to prevent it. For someone like me, I parboil it first. I discard that water because we don't know the chemical they use to preserve it. Then I put a new water to start cooking. And since then, I don't have heartburn for my beans. So study your body system. No one knows your body than you. Study your body system. Know what works for you. Know what you eat that triggers the symptoms of peptic ulcer for you, or that might make your stomach to start hurting you. Then avoid them. Number 6, be intentional about what goes into your mouth. Be intentional. We are what we eat. In fact, I got to realize recently that you don't even need cream like that in quotes. You only need moisturizing cream. If you eat well, if you eat healthy, you will see the results. So another thing is practice good hygiene. I've been repeating this over and over again. H. pylori is real. It's a bacteria, and it manifests more when there is poor hygiene. If you have symptoms that are related to ulcer, don't treat it blindly. Visit the hospital. Know the cause so that you can treat it once and for all. You can imagine what is causing ulcer, what is causing the symptoms is H. pylori, and you keep treating something else. It's not going to work. Or what is causing it for you is NZ. There is no H. pylori in the first place, and you are treating H. pylori. The cancer, the peptic ulcer will keep progressing, yet it's not treated, and you are packing medication that is not needed into your body system. Another thing is, never use a medication prescribed for someone else. From what I've been explaining since, we can see that there are different causes. So someone that his or her cause is H. pylori, another person's one is NZ usage. You are not using different medication, because someone that is H. pylori will be given antibiotics, and someone that is NZ and is not H. pylori will not be given antibiotics. Their treatment regimen will be different. So you are not using someone else's treatment. There are parallel lines. Your symptoms will keep on going on, and you are using money to buy the drug as well. So better safe than being sorry. So ensure you use your prescribed medication as recommended for you, and the duration, even when the symptoms have gone. We do this a lot. I'm having headache, and now the cause of my headache has been known. I'm prescribed a medication to use for 2 weeks. I use it for 2 days. The headache is gone. I'll leave it alone. Meanwhile, the reason why it's prescribed for 2 weeks is for effectiveness. But because after 2 days it has stopped, I'll drop it. Then when the headache comes back again, I will remember the medication. But what we don't know is, by the time the headache comes back, it's not going to come back like the previous one. Its level has changed. So that medication might not work for you again. There's what we call resilience, medication resistance in health line. So just ensure you finish it. It's not easy, but please finish it. And remember, health is wet. You need a healthy body to work or to do anything. Oh, I want to work. Oh, is this work that is not letting me to eat? When your health fails you, the work will continue. My mom used to say something, that the lifespan of job is longer than your own life. So take care of yourself. Though you are diligent with your job, you are so committed, but take care of yourself. Because most times we starve ourselves because we are so committed with our job. There's nothing bad in having schedule, like, oh, after I'm going to try and eat so time, and you try and stick to it, even if it's just to eat a fruit. Let something be in your stomach, so that those acid will not be eating your stomach lining. I can be guilty of myself. I'm speaking to myself as well. So when your health fails you, a lot of things will suffer it. Yourself, you will not enjoy yourself. Your family will suffer it. Your job will suffer it. Your community will suffer it. So please, let's take care of ourselves. Health is wealth. So thank you very much for listening, for attention. we can now drop our questions. If there's any question, we can drop our questions. Okay, there's a question. So what is the importance? Thank you very much, sir. There's a question here. What is the importance of drinking water early in the morning? Thank you very much, sir, for this question. My pastor, Beautiful Gate Anglican Church. Number one reason for this is, like I said, I made mention of it not quite long. The fact that, let's assume we ate our dinner 6 p.m. last night and we woke up 5 a.m. So that's like 11 hours. Even if we eat the dinner 9 p.m., 7 p.m. So it's more than 6 hours, 8 hours already. So our food would have digested and the stomach in a way will be empty. So there will be there will be generation of hydrochloric acid again, and in a way it might want to cause some pain for us when we wake up. But drinking water is neutral in a way, so it helps to like coat the stomach. At least it's not just the acid alone that is in our stomach at that moment, so that coats your stomach before you eat your breakfast. And secondly, it is good for our kidney. Very, very good, because the kidney has really worked overnight. So when we drink water, we are giving our kidney more water to work with. Because when we don't drink water, when we are hydrated, our kidney suffers it. And that's why we have a lot of acute kidney infection, AKI, in our world today. People are not drinking water. I don't want to go and wee. I don't want to pass urine. I'm fine. If I don't drink water, I will not pass urine. When you don't drink water, your kidney will suffer it. I hope I answered your question, sir. Thank you very much. We can drop our questions. We can drop more questions. We still have 10 minutes more. If there's anything you need clarification on from today's teaching, from today's class, you can drop it. And it will be pinned for everyone to see while I answer it. Any other question? Okay. We don't have any other question. That's fine. And like I said, like I used to say, if you have any question, personal questions that you don't want to ask live, you can always mail it to me. You can always mail it to me on MyHealth Matters. I'm going to drop it now. So you can always send it to this email address and I'm going to answer the question. Yes, so if you have any question, personal questions that you don't want to answer, it's fine. You don't want to ask here, it's fine. But you can mail it to me. Like I said, I'm going to reply it. I reply mails very fast, as much as I can. So MyHealth Matters 01012023 at gmail.com. Thank you very much. Who can guess our next system for the month of August? You know, we've looked at digestive system for July, and we have another system for August. So digestive system we are done. So we have one more Wednesday. We'll do question and answers next week Wednesday. But if you're not comfortable again, I'm saying send it to my email address. Yeah, send it to this email address. I'm going to reply. So who can guess our next system of the body for next month? Okay. And here it goes. Yes. The human excretory system. Do you want to know more about your kidney, your bladder, your urethra, how you make urine, how waste products are being excreted from your body? You want to understand more? Then come. August, here will come. We're going to look at each of these organs every Wednesday on Facebook as an article, 12 o'clock noon. We'll pick it one after the other. So we're going to talk about kidney. We'll talk about kidney one of the Wednesdays. We'll talk about bladder. Then we can talk about urethra in another Wednesday. Then a condition that is very common, like a disease condition that is very common with the excretory system. We are going to do it again as live like this at the end of the month, at the end of August. Thank you very much. Thank you for having me. Thank you for your time. Thank you for your contributions. Thank you for the questions being asked. It is well appreciated. Well appreciated. See you same time. Last Friday or Saturday, we're going to communicate the date, but same time, 8 to 9 p.m. next month. While as we look at an health condition related to the excretory system. But before then, like I said, we're going to look at the normal physiology, the physiology of the organs of the excretory system on Wednesdays of August. And it's going to be as an article on my Facebook page. Same name, Anenechukwu Damilola for boy. And I remain your favorite nursepreneur, Damilola Anenechukwu. Thank you for having me tonight. Thank you. See you same time next month. Thank you.